in high definition. It's about time, your time. Fox 11 Tucson Now, daybreak.
Well, a lot of people out there feeling under the weather right now with the flu. Dr. Jane Lykins joins us right now from FastMed Urgent Care. We are talking the flu, and how many people are you guys seeing right now, doctor, with flu-like symptoms?
The numbers are definitely up. We've gotten lots of positive flu screen tests.
And I guess when somebody has the flu, or they believe they have the flu, should they come into an urgent care to a doctor's office, or should they stay home?
If you're very young or very old or have any health problems, it's really important to get seen. The anti-flu medicine can really help shorten the course and get you better faster. If you're a young, healthy person, stay home, take Tylenol, ibuprofen, get lots of fluids and rest.
Gotcha. And how many days? I mean, we're talking a lot of people taking time off from work, taking time out of school. How much time should they leave before they do come back?
You can be contagious for 7 to 10 days when you've got the flu. So staying home for a good amount of time until you really feel better is important.
Gotcha. Because, I mean, really, anything you touch that somebody else is going to touch really becomes a problem.
Right. Which is why it's so important to wash your hands, especially before you touch your face, your eyes, your mouth. Cover your cough. Stay away from people who are coughing.
Gotcha. We've been seeing it here in the newsroom. I think a lot of people have been seeing it. Yeah. But one way to beat the flu is getting the flu shot.
The most important way. Yes.
The most important way. Well, I have not gotten my flu shot yet. We put it up on Facebook a little while ago, and I've been hearing it from people. I'm not too happy that I'm getting this flu shot. Conchetta set all this up for us, but I am going to get it just to show people how easy it is, and it could actually, I mean, save some lives out there.
Absolutely. Yeah, the new studies early on in this flu epidemic have shown that it's pretty effective. It decreases your chance of getting the flu by 60%. That's pretty good. By
60%? I suppose I can take that. All right, here comes the sleeve. We're going to do this. I'm going to try to get my sleeve as high up as I can because we want to be accurate here, right, doctor?
That's right.
All right. So everybody's been telling me it's not going to hurt at all, just going to be a little stick, not a big deal. I'm really been looking forward to this all morning long. She's just going to do it, and then we're just going to, wait a second, I don't even know if I even felt that. Look at that. Oh, wow. See, that's as easy as, actually, I didn't even feel a sting. That really went in, huh?
Yeah.
Wow. Very cool. Well, see, look at that. I was worried about nothing.
You don't even need a Band-Aid.
Don't even need a Band-Aid. I'm not much of a bleeder, I suppose.
There you go.
There we go. So there you have it. So that's how easy it is to get the flu shot now. We'll have to have Conchetta behind the camera get her flu shot. She says, now here's a common misconception, that you actually can get the flu from getting the flu shot.
You cannot get the flu from getting the flu shot. It is not a live virus. It's just proteins within the virus. And you can feel a little achy because that's your immune's response to the shot. But you cannot catch the flu, and you cannot give anyone else the flu from the flu shot.
There you go. I'm starting to feel it a little bit now. But that's okay. It's not going to be that big of a deal. Well, thanks so much for watching Daybreak. Thank you, Dr. Jane Lykins from FastMed Urgent Care. We'll be right back.
Now, in high definition, it's about time, your time. Fox 11 Tucson Now, daybreak.
Thanks, Aaron. I'm Emily Turner. I am here with Dr. Jane Lykins from FastMed. And that cold weather that Aaron was just talking about, that's always bad news for germs. And speaking of which, we have the norovirus. Now, this is something that's on the rise. What exactly is this?
This is your typical stomach bug, or the winter vomiting infection. Norovirus has been around for decades, but just recently in the last couple years it changed a bit when it was in Australia, and now it's found its way to America. And that means that people don't have any immunity to it, so they're more likely to get sick. And this one seems to be a little bit more severe, making people a little bit sicker. Lots of vomiting, lots of diarrhea, stomach cramps, low-grade fever.
So that's the bad news bears. That's the day that you want to take home or stay home from work. What exactly can folks do if they feel like they have this? What do they need to do? Do they need to go to the doctor? Do they just stay home?
Yeah, if you're a young, healthy adult or an older child, no underlying medical problems, you really just need to stay home. Push fluids, take small amounts at a time, try to stay hydrated. The good news is it lasts about a day to 3 days. So you really feel awful for that amount of time, but you can muscle through it and you should get better.
Now, in that amount of time, when are you contagious? I mean, what do you need to stay away from, that kind of thing?
Yeah, the incubation period for this virus is anywhere from 12 hours to 48 hours. So if you get exposed to it, 12 hours later you could get sick, and during that time that you've been exposed, you could give it to others. The most that you're contagious, though, is while you're having the vomiting and the diarrhea. And for about 2 days afterwards. So even after your symptoms have gone away, you're still going to feel pretty bad because you're dehydrated, and you should stay home through that amount of time too.
Now, is there a particular group of people who are more at risk either to get this, or once they have this, they should be really worried?
Yeah, if you have any underlying medical problems that might lower your immunity or make you weaker, very small children who get dehydrated quickly, very old people who don't have a lot of reserves, these are the people to worry about. Have to be very careful to watch for dehydration, very dry mouth, tongue sticking to the roof of your mouth, getting really dizzy when you stand up, not urinating all day. Then you really need to go in and see a doctor. You can come to a facility like FastMed, get anti-nausea medicines, IV fluids, really help tune you up a bit.
Speaking about medicines, we talked about, you know, maybe you can do some Pedialyte to stay hydrated, but as far as like the Pepto-Bismol, that kind of thing for the other less...
Probably not going to do much for you, and there's some thoughts that it might actually prolong the illness. So you really just have to push through it and let it flush and run its course.
Perfect. Well, thank you so much. I appreciate it, and we will definitely be on the look for this norovirus. And everybody keep your hands washed and stay
good hand washing.